Welcome back to the Now Morning Show. Now, last week on Your Body and You, we delved into the classification of what headaches and what causes them. We even learned that magnesium supplements can assist in minimizing the occurrence of some headaches. And this morning, we're going to go deeper and continue the discussion with Dr. Kerly-Ann Tobias-Joseph. Doc, good morning. Thank you so much for coming back again and continuing the conversation with us on headaches, of course.
Good morning. It's a pleasure to be here.
Yes, and I know that you're joining us on the phone again. And I want to jump right in. We would have discussed some of the causes, also what we can use to treat those pesky headaches. Now let's look at some of the things we can do to see if we can understand them in terms of what sort of tests can we order to see or to investigate the root or cause of these headaches.
All right. Well, one of the first things that persons can do at home is to check their blood pressure. Right, because you want to make sure that your blood pressure isn't elevated. But let's say you check it and it's fine, and you need to go to see your doctor. So one of the things that your doctor may check, after examining you and getting your history, may be an X-ray of your neck or of your sinuses, because there are cervical spine issues like spondylosis, which may cause a headache,
right.
Or you may have a sinusitis. Right? Now, for someone who has been having a headache for a long period of time, like constantly for months, and this may be erupting into neurological symptoms, one of the things that we are going to be concerned about is if this person has a tumor. And to check that, you would need to do a CAT scan. But let's say if it's something acute occurring and the blood pressure is really elevated, and they have weakness of the hands or legs, slurred speech, difficulty getting their words out, or they're not as conscious as they were before. Of course, you need to rule out a stroke, and a CAT scan is also necessary.
Right.
And besides that, there are other things like, testing the blood for infection or anemia. Do you know that a low blood count can give you a headache?
Did not know that.
Yeah.
I'm learning it this morning.
Yeah, and of course, there are the little things, especially in children. They're complaining of headaches. You need to get their eyes tested because maybe they're straining to see on the board,
Yes.
And that can cause headaches as well.
And so let's look at it at home because sometimes maybe we may want to self-test at home. So are there any sorts of exercises we can do while at home to, try to define or try to figure out exactly why we're getting those headaches?
Well, you see, the thing is that because the causes of headaches are so varied, and I know we spoke last week about some of the little things that you can ask yourself about the water you drank, or if you ate on time, if you ate things that would trigger your migraine.
Right.
But I would say one of the most important things that someone can do for themselves at home is to check their blood pressure.
Mm-hmm.
It's super important because that is something that you can actually self-test. You can't test your own eyes or give yourself an MRI or do a lumbar puncture to see if you have meningitis now.
Yes.
So you can check your blood pressure at home. And interestingly enough, next week, Wednesday, on the 17th of May, the world celebrates World Hypertension Day.
Mm-hmm.
Right?
Yeah.
So how do you even know that your blood pressure is elevated? When you check it, you're looking to see, the typical number that we would use, 120/80.
Mm-hmm.
Yeah, right? But do you know that the lower aspect of a normal blood pressure is 90/60?
90/60. So that is on the low side. So that is not where we're supposed to be.
Well, that's the lowest that you're allowed to have it because there are some persons who are slim built. I'm sure you've seen some persons are really, really slim built. They're really tiny, and their blood pressure may be as low as 90/60. But do you know the importance of checking your own blood pressure? It helps you to know where your normal level is.
Yeah. Well, Doc, so I have a question because a lot of us may not have that tool that you need to use to check your blood pressure. Is there a manual way to check it? That's one. And then what do those figures mean? Because you go for a checkup and the nurse takes that, she pumps it, she takes your blood pressure, and you see figures like 120 over something or whatever. So is there a way to test manually, or do you need to have the tool? And then secondly, what do those numbers mean?
All right. So I would suggest that every home should have a blood pressure machine. I think it's a great investment to have, and especially with the COVID-19 pandemic where, you know, a lot of times you're quarantined at home, and I think it's one of those really, really important things to have. So what those pressures mean, those numbers mean, the top number or the first number that you would typically see when you look at the monitor is what we call the systolic blood pressure. Right? And that is the pressure, as in the force at which blood leaves your heart and gets into your aorta. And the second number is your diastolic blood pressure, which is the pressure that remains when your aorta closes.
Yeah.
Right?
And where do those figures need to be to ensure that we stay healthy?
All right. So that's a great question. So the range for normal blood pressure is now 90 over 60, all the way up to 120 over 80. Now, a lot of persons exist in the 130s, 140s, and they say, Doc, that's fine. But right now, stage 1 hypertension is defined as anything from 130 over 80 up to 139 over 80. So you could say 130 over just over 80, or 139 up to 90. So once you have more than 140 over 90, that is considered stage 2. And if someone checks their blood pressure and they see anything more than 180 over 120, this is a medical emergency and they need to seek attention right away.
What sort of medical emergency is this, Doc? Is it worse than hypertension? Is it hypertension? Could it be signaling something else?
Yeah, definitely. Because the thing is, imagine if your normal blood pressure is supposed to be up to 120 over 80, and you're telling me that your pressure is 180 over 120.
Something is wrong.
Yeah, I mean, definitely. And one of these things, you know, we do suggest, because some persons experience a really terrible case of what we call white coat syndrome, you know, which is where when they go to the hospital or they go to the emergency room, they're so afraid of being at the doctor's office that their pressure can actually appear that high. Just because of fear and anxiety. And this is the importance of checking it for yourself at home. There are no doctors there, you know, and even if you check it and it looks a little high, the suggestion is just wait a few minutes, check it again, and see what it comes down to. But if it's still that high, especially if you're having headaches along with it, chest pain, shortness of breath, you don't delay. You immediately call the ambulance and get to the hospital, because you can be having a stroke, you know, or even going towards having a heart attack or, you know, a sudden heart failure.
I actually like that you mentioned that, because I think sometimes people, when they prescribe themselves and they see that high reading, they automatically think it's hypertension. But I like that you mentioned that it may be something else and that they should seek medical attention. But Doc, before you go, in terms of lifestyle choices, if we have that monitor at home and we begin seeing those really high figures, what are some of the things that we can do now to address and even to change those figures that we're seeing?
Right. So the first thing I'd want to mention is just really, really important to check the blood pressure. Some people know that they have hypertension, or as far as the last time they checked and it was fine, but you have to keep checking to know where you're at now. So the important things would be like cutting back on your salt intake, starting an exercise routine, you know, limiting your alcohol intake, reducing stress. Stress is a really amazing thing in terms of high blood pressure. There are a lot of persons, they're fine, you know, on a regular day, but when they get stressed, the pressure can go so high. And I've had patients who had a stroke in a stressful situation, right? So managing the weight, trying to lose weight, reducing your stress, getting in your exercise. And if you have medication for your high blood pressure, take it. You know, and as you are changing your lifestyle, the interesting thing is as your weight reduces because you're eating healthier and you're exercising, maybe you would not need as much medication anymore. So it's important to check it, document it. So when you go to your doctor's visit, you can say, Doc, my pressures are improving. What do you think about that?
Yeah. And finally, Doc, before you go, are there any other symptoms that will present if you have high blood pressure or hypertension? Because I've often heard people say, you know, I have high blood pressure, I have hypertension, and behind my neck is hurting. So are there any other areas of the body you might get this sort of effect?
Yeah. So, of course, you can have headaches, you can have neck pain or stiffness.
Yeah.
Some persons may have chest pain or shortness of breath. And a very common one is a kind of lightheaded feeling, feeling like they're drifting. And you can have that feeling with either high or low blood pressure. But you know what's the most common symptom? Nothing at all.
Really? That was like I was pausing to hear what was that reason going to be? No symptoms at all. So you could be walking around and not know.
No symptoms at all. And that is why hypertension is called the silent killer.
Yes. Yeah. Well, Dr. Joseph, we're going to leave it there for now. Let me thank you so much for, coming in, even though it's via phone, just to share with us exactly some of the tests we can do, of course, as we look forward to World Hypertension Day, and, of course, being sure that we have that monitor at home to always check and monitor our blood pressure. So thank you so much for joining us this morning.
You're most welcome.
And that was Dr. Kerly-Ann Tobias-Joseph, MD, the founder and director of Emerald Health and Wellness, just sharing some tips on how we can test at home to see, how our blood pressure readings are, and also an important tip to ensure that we have a blood pressure monitor at home. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.